What are the symptoms of cancer? This video is maybe not going to be particularly satisfying. Um, there are many, many, many symptoms of different kinds of cancer. Many cancers have many, many different symptoms. The problem is those symptoms are going to match up with other conditions as well. They're also going to match up with no medical condition at all. And yeah, this is what makes it so difficult to find cancer often until it's too late. So many cancers don't really cause symptoms until they're quite late stage, and unfortunately, as cancers progress to later stages, stage 3 and 4 cancers, they're harder to treat. The treatment's more unpleasant. The success rate is lower. Yeah, it's a very, very unfortunate situation. So there could be symptoms like pain in a certain part of your body, which could be caused by lots and lots of different things. Abnormal bruising, abnormal bleeding, headaches. So, I mean, general symptoms that were associated with lots and lots of different diseases and no disease at all. I mean, vast majority of chest pains that people experience are not a heart condition, for example, or a big cancerous tumor growing in your chest. The majority are musculoskeletal. Many chest pains are caused by things like acid reflux. That could just be a random thing from what you ate, or did you have a large meal the previous night and go straight to bed and yeah, have a very unpleasant night of pain. That's not a cancer symptom. That's yeah, potentially acid reflux. So there are a multitude of cancer symptoms. It's not, I guess it's not particularly useful looking out for them. However, a couple of things are really useful. Now, one thing is cancer screening. Cancer screening, as far as I know, doesn't work in terms of society and population. However, as an individual, if you have do some cancer screening tests and potentially this allows you to find something early, it could have a massive impact on your life. There's yeah, cancer screening kind of blood tests you can have health checks. So here in Japan, adults have a yearly health check, and that includes some cancer screening tests depending on your age. Colonoscopy is a way to find colorectal cancers, and I think quite uniquely, or almost uniquely, colonoscopy can find evidence of things that could turn into cancer. A bit like, I guess, if you have like a new mole appears on your skin, this is something worth getting checked out because it could, it could be cancer or turn into cancer, I guess. So colonoscopy can find polyps, which are little growths inside the intestines, and these could be cancerous or could become cancer. So it's really worth getting your colonoscopy. So yeah, screening is maybe not it's not very effective for and from an economic point of view for people deciding healthcare policy, but as an individual, screening is probably very good as long as you don't get massively stressed out and freak out about it. And also that you don't get really complacent, saying like, well, I had a colon cancer stool test last year and it was all clear, and I'm fine. Yeah, a sensible attitude screening can be very useful. And kind of beyond that, just being aware of changes in your body. So keeping a diary, like if you do notice something's not quite right, start listing when it's happening, what's happening. I mean, apart from anything else, it makes it so much easier to get a doctor to refer you for proper testing if you can say, I've had strange bleeding 6 times in the past 2 months and this is when it happened and it's really odd. Yeah, instead of just saying, well, I think things have been a bit strange recently, not really sure when or how much, but give me some testing. So cancer symptoms, it's like a very tricky thing because there are just not really symptoms unique to cancer. They match up with so many medical conditions, and as I keep saying, they match up with just random stuff that doesn't necessarily indicate any underlying medical condition. But doing the screening tests, so when you're a certain age, getting the recommended tests done is really worthwhile. And being aware of like changes in your body, kind of weird stuff going on, noting it down, strange marks on your body, take a photo and save it with kind of the date and maybe in a folder with a text file with some details about it, so that if you feel things are not right, you can turn up to your doctor clutching your tablet or cell phone or whatever and say, look, this has happened 4 times this month, let's do some testing. Evidence will make your case stronger and potentially give you peace of mind, because hopefully the doctor will say that rash is caused by X, Y, and Z or whatever, or or they will do some testing and you'll get the all clear. So watch out for changes and do whatever screening is available, especially colonoscopy. As you get older, gastroscopy as well. So stomach cancer, really worth looking for any ulcers and stuff forming. And if you have a ton of money, yearly PET scan is really good. If you're sort of 50 plus, really worthwhile if you're able to afford it, or you have insurance that covers it, or if your company offers any kind of health check as part of the health package, take advantage of that. Okay, so I hope this video was useful, although it's a rather tricky, messy subject. Okay, thanks for watching.